Welcome everyone to this Connect and Learn session. My name is Ashley Eaton and I am from the Boost team. And Boost is our learning and improvement community in North East and North Cumbria. So we are going to be joined today by Sarah Penn, who is from Cumbria CVS, formerly Happy Mums, Lucinda Bray from the Happy Mums Foundation CIC, Anne Broadbridge from Waste to Wellness, Sandra Guy's Maternity and Neonatal Voices Partnership Group, and finally, Caro Class and Abby Durrant from Open Lab Newcastle University. And in this session, they're going to be sharing their learning from their participatory research project, which was co-designed and produced with academic, VCSE, lived experience and NHS partners. And we're also going to be challenged to think about how ready our organisations are to hear and respond to holistic life course experiences, especially of mums and mums-to-be. I can have the next slide, Sarah, thank you. So these Connect and Learn sessions are a series of online learning events planned with the purpose of sharing and spreading improvement work across North East and North Cumbria Health and Care System. Each has a different focus, so the Connect and Learns are more than just information sharing. They are an opportunity for you to connect with like-minded individuals around a specific topic, generate ideas, and take forward improvements in your own work, team or service. Next slide, please, Sarah. So before we kick off, just some very quick protocols. Please keep yourself on mute when not speaking. Post any questions that you have in the chat, and we'll also build in time for questions at the end. Please listen with respect and be present. Pass on, share the learning, spread the word about these sessions. And finally, please be aware that we are recording the session. So also if you've got any colleagues that might want to listen, it will be available on our YouTube site by the end of the week. And so I will now pass over to Sarah and the team.
Hi, welcome. Thank you, everybody. Thank you for having us and thank you for signing up to this. So my name's Sarah Penn. I currently work for Cumbria CVS, local infrastructure organisation for the VCSE in Cumbria. But really, my involvement in this project came from my own difficult maternity journey through depression and as an inpatient in a mother and baby unit, and then going on to volunteer and work for the Happy Mums Foundation, a social enterprise based in Cumbria. So today, and you'll see one of the zines that was part of the project that we're going to be talking a bit about, See the Whole of Me, a community life course approach to maternity listening. So in this, we'll be showcasing the voices and the experiences of some incredibly strong, incredibly vulnerable and complex mums and mums-to-be. And I am one of them, so I'm one of the voices that took part in this research. The title came from their stories. Again and again in those stories, we heard how complex their maternity experiences were. We heard how they didn't fit into the categories and the boxes, those labels that our system creates. And I think that illustration really kind of nicely shows that all of these labels and terms that people have associated with them through that journey. We also heard how lifelong those stories are, those journeys into motherhood. They didn't start at conception and end 1 or 2 years after the baby was born. There was trauma, grief, and love were all layered and overlaid and then surfacing and resurfacing at different points in time through people's lives. So you're going to hear from a range of collaborators, and that really reflects the process of this project. So it was a project born of many voices, and so the voices that come out of it, yeah, there are a lot of them. So in terms of why it's important, sorry, I'm supposed to be doing my own slides. I'm like waiting for somebody to do it. So why it's important. So the topic of maternal mental health, just a few basic statistics to highlight its importance. I'm sure many of you will be very, very familiar with these statistics. So at least 1 in 5 women experience a perinatal mental health problem. 70% will hide or underplay those difficulties. And suicide is still the leading direct cause of death in the year after giving birth. And that in the most recent report, that was actually getting slightly worse. And there are huge inequalities in maternal health and mental health. So that just in terms of why it's important to hear these voices. So again, why it's important, why do these statistics stay the same in terms of those marginalised voices? We've had so many reports into failings and scandals in maternity units, and they all seem to come back to the same thing, the same lessons, the same repeated themes, the repeated trauma, that women are not being listened to. Women birthing people and families are not always being listened to in the way that they want to be listened to. We know that there are huge competing challenges within our system, the NHS generally. We know those pressures, and the staffing pressures, the financial pressures. We know that maternity services specifically, increasingly complex, birthing people and women coming through the doors. But I suppose what we want to come back to is, what do we really value as evidence? Do we only value the numbers, or do we also value the person in front of us and their complete story that's there? So there are, I'm just going to highlight a few of the things that have come out in some of the key reports. So Darzi, in his great big survey of the NHS as a whole, today, too many women, babies and families are being let down. But I think the last point is interesting. The first step is to acknowledge that the problems are complex, and that adding more staff in itself doesn't just address them. And I think it's really the complexity and acknowledgement were really key to this, the work that we did in terms of how we listen to the women, but also how do we then move that forwards. Those social complexities in those vulnerable women who might be more hesitant to engage with services, and how if you don't tailor your responses and your efforts to those groups, then you're only going to make those inequalities worse, essentially, through unintended consequences, because nobody wants to create these consequences. Nobody wants to create trauma and exacerbate inequalities. It's not why we do what we do. And then finally, as a quote, just the all-party parliamentary group and birth trauma, which also came out last year. The common theme running through all of those personal submissions to that was of women not being listened to when they thought that something was wrong or when they asked for help. So just a few kind of, and those, I think it's the repetition of the same themes that is really kind of important there, like what is not happening to enable this listening to create change. So in terms of what we're going to cover today, we know the topic's vitally important. It touches all kinds of services and groups and people. We know those numbers. We know the economic cost, that generational cost as well. But I suppose what we want to do is to show you the stories behind those numbers and how valuable those stories are in themselves and for themselves. We know that the system struggles to listen. We know the cost of that failure. We know those reports keep saying the same thing. So we'll, in a second, I'll hand over to Lucinda to talk through what maternal and perinatal peer support looks like, and how we use those principles of peer support to underpin this research, how we really treated this space as a peer support space and the stories as something that we needed to care for. And you'll hopefully find through this, what does genuine collaboration look and feel like, and how did we create that space of trust for vulnerable people? We know that it's incredibly difficult when you are experiencing some of those challenges and vulnerabilities to trust people enough to share your story, and so then your story isn't heard, and then your voice is not part of the conversation. So how can we ensure that these stories are cared for and valued? And that's part of how we created the process, but also what we do with those stories afterwards. Have I got another one? So in terms of what we're going to be asking of you, is on top of the general principles that Ashley brought in. So we'll be asking you to connect with the humanity of these stories, with the whole of the people, and with the challenge that again Ashley touched on in terms of why is it so difficult to adapt our system to hear these voices. So listening, learning from the positive and the negative, and reflecting on the challenges that might be very personal or very system wide in terms of how can we actually make changes. And we're hoping that you'll be able to commit to taking some action to change the way that voices are heard. And that could be in maternity, it could be in other services. But how can we view people as a whole when the system constantly tells us they need to be broken down into categories, into labels, into work streams? How can we sort of fight against that? But it comes down to this: can we see the person in front of us as who they are? Can we listen and truly listen to those signals that they're giving us? I think that's my last one. Yeah, so over to you, Lucinda, for a bit of background about Happy Mums.
Thank you, Sarah. So I'm Lucinda, and I'm the Managing Director of the Happy Mums Foundation. Happy Mums was launched in 2015 by Catherine Dalglish, who had herself been admitted to a mum and baby unit when she was with her child, and really struggled with postnatal depression. And one of the things that she found most useful while she was there was the peer support groups there, the connecting with other mums, knowing that she wasn't alone in the things that she was feeling, being able to dig into some of those thoughts and see that other people around her were experiencing similar things, and how she felt actually listened to and not dismissed. And that's how Happy Mums started. She wanted to bring those groups to Cumbria, and slowly over the years it's evolved and changed as we try and find the best way to support the mums. And on average, we support around 100 mums annually to better manage their mental health through the shared experiences and through the power of knowing they're not alone. In the last year alone, we had over 1,200 attendances at our support groups over the course of the year. And 92% of the mums that come to our groups feel less or much less isolated. 81% have an increased social connectivity. 58% feel that they're more able to cope with day-to-day life. And we also want to make sure that we're looking after our volunteers as well. And 75% of those feel that they're more resilient due to volunteering with us. So some of those statistics alone just show how important and how much of a difference peer support can make. While in a way it feels like quite a simple concept of just bringing people together in a room where they can just talk to each other, there's actually quite a few guiding principles in there that help us to make sure that that space is as safe as possible. And so these are the 5 principles of good perinatal peer support that were developed by the Maternal Mental Health Alliance, along with a number of organisations a few years ago. And we use these as our guiding principles for how to create these spaces, how to train our volunteers, and how to make sure all of those involved in Happy Mums understand how important it is to develop these things. So the first one there is good perinatal peer support is safe and nurturing, and that safety comes in a lot of different guises. It's not just about, we don't have security guards on the door. It's not that kind of safety, but it's that the space is a space just for them. We don't have people intruding. We don't have medical teams. We don't have random visitors. We often get asked, but we don't have visitors coming into the groups. It's just the mums, and it's just there for them. It's accessible and inclusive, and this is one that is constantly changing in terms of what inclusivity means and how we make things accessible for the mums that are there. And part of that is us constantly listening and learning to the challenges that people are coming across, and what does that look like. It complements rather than replicates the work of clinical mental health services. And I think another example of that is this project as well. It's making sure that we want to be specialists in peer support, and we focus on that peer support, but we signpost to all of the other amazing services that are around. And it's very much about having a network of support in different places and different teams that can come together to support that person the way they need to be supported. And I do think that this collaborative work is an amazing example of that. Good perinatal support also provides, sorry, Sarah, opportunities for meaningful involvement with people with lived experience. So I think being able to use lived experience is a very powerful thing for those that have been through it. So all of our volunteers, our staff members, our board members also have an element of lived experience of maternal mental health. And it's so many times we hear from those that are involved that it is so powerful to be able to use their stories to benefit others. And again, this project and how this is working is another one of those ways that they want to kind of develop that and work forwards. And good peer support benefits everyone involved, including the peer supporters. So, like I said, all of our volunteers find so much development from that. And it really helps us as an organisation to keep listening, keep building, keep working with other organisations to make sure that we're delivering what the mums need. And it's always in conjunction with those mums. Thank you. I'll pass on to the next person now.
Thank you, Lucinda. So hi, everyone. I'm Caro, and together with my colleague Abby here today, we're going to talk to you about what did we do and how we understand co-production. So first, I'll just run through what we did in this project. So together, we ran a couple of co-creation workshops with 12 moms and moms-to-be at perinatal stage of pregnancy and parenthood. The aim was to capture really diverse voices, which actually can be described as marginalized voice. So we had a lot of participants who had experienced, for example, homelessness or the asylum systems or criminal justice system. We also had participants who were from the LGBTQ plus community, Black and brown moms, and moms who self-identify as neurodivergent. So really aiming to capture diverse voices. And the workshop actually were framed as part of a bigger scoping research project, and where we aim to understand the needs relating to maternal well-being and also explore together the possible barriers to accessing support and services in our region. So we took an inclusive, creative and participatory approach to raise awareness, whilst promoting listening with community. Those voices may be unheard or excluded from the system. Yes, and this is the beautiful space where we were lucky to run our workshop. So we had the workshop in Holmhead House in Carlisle, just by the river. It's a beautiful community center. They specialize in playful education, and they do a lot of community-based work. If you haven't been, really urge you to check them out and definitely consider them for community-based work there. It's really beautiful. So during the 2 days, we shared food that was actually homemade by the owner. We covered childcare and transport, and participants received vouchers. And the next slide shows a few more visuals of the space that really communicate the kind of really cozy atmosphere, also vibrant atmosphere with all the materials. And during the 2 days, so the women explored narratives of motherhood, but also challenges related to their pregnancy journey through collage and zine making. So that kind of making really facilitates shared experience and listening from each other. And I'll pass now to Abby, my colleague Abby, who will talk about the co-production aspects.
Thank you, Caro, and hello, everyone. Yes, so I'm just going to say a few words about what co-production in our team means to us. So we invited different kinds of contributions to our study team. Our partners, as we've said already, came from different backgrounds and had different expertise, sharing, however, this common passion for community-based work and improving access to health and care for women and birthing people from diverse backgrounds. So these diverse stakeholders, and because it hasn't been said yet, this is across sectors too. So obviously, Caro and myself are at Newcastle University, and we worked with representatives from local authorities as well as the voluntary community and social enterprise sector and NHS. These diverse stakeholders contributed to the design of the study and how we would work with people in the way Caro's described. So we refer to this as a study protocol, and this allows us to make sure that we systematically review what we're going to do before we do it and make sure that we think about ethics and risk mitigation. We did that very collectively. And part of this involved listening to these diverse stakeholders about how we should think carefully about the use of inclusive language. And that includes kind of thinking about how to form research questions in the first place. And also things like how we might recruit participants for the workshops. it was also important to have people with lived experience in the team to help facilitate connections and peer-to-peer sharing. Carrie's going to say a little bit more about that in a moment. Although our participants' experiences were very diverse, we really all together were able to find common things and relate to one another. And I think Sarah communicated that very strongly at the start. So having peer support organisations and key individuals with lived experience liaising with potential participants and those people taking part as they were taking part in the workshops and afterwards was critical for safeguarding and just checking in on people. And this helped us build a sense of trust with each other in the study team, but also with our participants, and to help create that non-judgmental space for engagement. And we want to highlight how this trust element is important for what we see as a longitudinal engagement with this work. So what we mean by that is we want to work with each other and with the people who we've engaged with this for the long term, and think about how we can cultivate continuing conversations and engagement and widen engagement. And so this work that we've done at Newcastle University with Happy Mums and Ways to Wellness and Cumbria CVS feels like, so incredibly trusted and valued for the long term. And we have recently secured some follow-up funding to co-produce an animation that will help disseminate key messages from what we've learned at the workshops, but also support these continuing conversations. And Caro is going to say a little bit more now about what we mean by following kind of peer support principles.
Yeah. Amazing, thank you. So just to actually, this is a really lovely quote to follow up from what Abby was saying. So from Sarah on the team, who reflected on the process, the collaborative process between us, and she said this project represented a radical departure from the kind of interactions we had with researchers, as we were truly collaborative, equal partners, able to drive the direction, content, and essence of the research. We felt ownership, and as such, were able to pass this sense of empowerment and control onto the group members that took part. Very important, this idea of equal partner and dynamics between us. So we really try to reflect as we go along and maximize the kind of equal partnership between us. So how we did it. So again, building on what Abby said, informed by peer support principles, the approach really, we aim to really foster that sense of trust and non-judgmental attitude and a lot of empathy between participants. So I guess the icebreaker here, can see a picture, was really key. So one of our co-facilitator actually came up with the idea of building on her own practice of working with groups, a marginalized group or people who were vulnerable. So she used that method of throwing a ball of wool to each other and to trigger or to kind of, to prompt people to share something about themselves, anything that they would be happy to share. And the next person would kind of build on what the previous person said. So in the end, we ended up with this kind of web of connections, physical connection between us that really kind of help us start the day and understanding kind of more tangibly, like, what does it mean to us, being connected to each other. Defining group rules, again, building on Happy Mom's expertise, was very key at the start of the workshop. Abby talked about the importance of having people with lived experience actually at the workshop sharing as well about their stories. So blurring the boundary, between participants, facilitators, and that really helps foster peer-to-peer sharing and the kind of sense of trust between us, and help also relating to one another. Safeguarding and transparency were actually also key. We had people really checking on participants, making sure everyone was fine, before to get there, but also during the day. transparency, I guess that connects as well to consent and gaining consent from participants, something that we see as very active and dynamic. Actually, even today with the animation, we're in the process of getting back to all participants to check again a year later how they're doing. Are they happy for us to, again, use the data or the stories in another way with the animation than we planned at the start? So really, this kind of, again, longitudinal aspect. And finally, accessible and inclusive. So liaising with participants, making sure everyone could get there safely. With the appropriate support, being flexible with workshop planning, childcare support was really critical, and we were lucky to have a wonderful lady who came on site to look after the children downstairs, and partners were also welcome. And we kind of had the workshop upstairs, so the partners could kind of enjoy the space downstairs and some food whilst the participants were upstairs in the workshop. The space was really good in a way that it accommodated the group sharing, so around the table together, but we had also a couple of participants who preferred this kind of more one-to-one, more intimate sharing. So we were able to kind of curate those spaces, so for people to sit down together and capture stories more on a one-to-one level interaction. And just to emphasize again the importance here of making at the workshop, we felt really was successful in terms of helping us to make sense collectively of people's experiences. So through making zine collages that really supported people's sense making and interpretation of their own experiences as they're still going very much through them, and considering different formats for dissemination. So we mentioned that we do this very collaboratively in terms of analyzing the data. It takes time, and we also consider different formats. So thinking about zine, like little booklet, illustrated booklet, or now the animation, as well as a report, so to try to think about different ways. And getting back to participants, we published, for example, a blog post with some insights that was very visual. So we shared it again with everyone. So and following up as we are doing now as well with the animation. So this is very important. We also briefly talk about the value of the longitudinal approach. So getting back to participant a year later, a lot of our participants at the workshop mentioned not being in the right place at this time and wanted to share more. So actually having now this follow-up funding and project is giving them another opportunity to follow in time and check in again with them if maybe they would be willing to say a little bit more about their story. So there is value as well in terms of taking our time. And this, I love this picture here. So with one participant who wrote No Choice in the little zine she was making, and that connects really well with some of the insights that are on the next slides. And thank you, Sarah. So those are really not new, I guess. Some of you will be very familiar with what we're saying here. Sarah already said, it's those themes are coming back again and again. We are aware. So some of the participants here describe not being listened to or heard. They describe many cases where the concerns or the pain, both physical or more mental health, pain related to mental health, were very much dismissed. For instance, one participant talked about being diagnosed with baby blues after birth, when indeed it was postnatal depression, and that really took time for the team to acknowledge and see that and listen to her whilst she was saying that she wasn't well, but she didn't really feel listened at all. And another case of a participant who, back for her pregnancy, when she was a teenager, she said that how her voice kept being silenced. So really strong, language here, actually, that we really hope to take that forward into working on the finding and the animation. Another theme, again, around informed consent and choice. So our participants did not feel really informed about the different options available or why a decision was taken. This is an example of a participant having to being induced and not understanding at the time why so, because she was feeling healthy and listening, to her body. And And yeah, a lot of other accounts describe, cases where participants felt not having any choices or feeling helpless, or even in some cases not cared for. There was some really also positive aspect with, medical team in terms of caring, but there were also stories where in instances where participant really felt not cared for. So how can we think about, compassion in those cases? And and connected to that, participant also talk about doctor assumptions also, so making a lot of assumptions and not disclosing maybe the right information because we assume that women would know already, so we also observed that first-time moms at the workshop actually said they tended not to question or ask things, and back in the days, they've just followed what they were told. But at the workshop, they reflected that now, they knew what the options were, and they would do things differently. And some already done that because they had the second child, so they told us the second story about how this time they stood up for their rights. And yeah, this is from the little zine we made as we were making sense of some of the findings. And that really demonstrates another theme that came from the findings around this incredible sense of resilience from participants that they built, not only, as Sarah was saying, just around birth, but actually through the whole life. And so those narratives don't just appear at birth or when pregnant, they actually follows the participant throughout. And here it's a couple of quotes from two participants saying how they had to fight from day one, and all their life they've been in survival mode. So really, complex life situation, complex needs, but very rich, stories. Next slide. And this sense of resilience and complex life connect to what participants really reported, this lack of support. So even though they've developed this incredible sense of resilience, through their life or pregnancy journey, they also reported mental health challenges and trauma that was even strengthened with the birth experience in some cases. And in the situation where our participant experienced homelessness in prison, for instance, there was, actually no support available to them. And that was really, it was needed the most because they were dealing with a lot of uncertainty, and an increased sense of isolation. And there was some discussion also that emerged between the participants around the little support available for dads or partners. And that was nice in a way, like a lot of the participant and facilitator got to kind of talk about that and also exchange information. So as part of the workshop, throughout the workshops, actually, there was a lot of learning and signposting to key information. And we're finishing with the last insights around that we wanted to share with you today, really to highlight, and that was really highlighted and voiced at the workshop, the significance of peer support and how the participant just develop their kind of resilience and strength through coming to peer support that they really describe as life-saving. And this was in the context of Happy Moms here. So how it kind of prompted a hope for the future. So we wanted also to highlight that here, the significance of peer support settings and being together and connected with each other. Right, and I'll pass it to Ange and Sandra. Yes.
Thanks, Carol. My name is Ange Broadbridge. I'm Head of Implementation at Ways to Wellness, and for the last 3 years I've had the real privilege of delivering some social prescribing prototypes in 4 areas of northeastern North Cumbria around maternal mental health. I think the thing I want to start with saying is that these findings really match and are part of a much bigger journey, I suppose, that we've been on as a VCSE sector around maternal mental health over the last number of years. And these findings really match listening events and activities that we've been doing with women for a much longer period of time. So, for example, Ways to Wellness maternal mental health link worker prototypes, we tested women having a social prescribing link worker during their maternity journey. We found that women really valued the role of the link worker in their lives as someone who was trusted, someone who was independent of statutory services, and crucially, who really had the time to listen, to help them to make sense of their experiences and also to connect them to other women and families in their local area either through peer support or through a range of other support and services that BCSE organisations can offer. I think when we started this work, and I can see Joe's on the call today, I always quote Joe here, we started this work, as Sandra said, with some mapping. And I can always hear Joe saying when she started that as our link worker based within Together We CIC over there, that women just wanted to meet with other mums who were like them. And a big part of Joe's work as she was getting the link work off the ground was about trying to support women to make those connections, and in some cases in developing new opportunities for people to get together. And then also looking across our learning, we delivered these workshops, but we've also worked together as part of another collaboration on an event that we called Mumkind in North Cumbria, using the same venue, Homehead House. I think probably fair to say we've developed a bit of what we describe as a model of care around this way of working and listening. And again, the findings, although we worked with a different subset of women there, were very similar. So I think we hear the same things coming through the reports, but actually we're now seeing, we also see and hear the same things coming through in those opportunities for listening and learning from women. We want to use this time with you this morning now to pose some questions that you might want to respond to now, and can either do that verbally. I can see some people have popped some things in the chat, so again, feel free to use that as a space for questions. I know not everyone's always comfortable with verbalizing questions and comments, but with an open offer from us to connect with us, to explore this further if it's of interest. And we know that some people on this Boost call will be connected to the maternity world, but actually Boost attracts people across a wide range of sectors. I'm not sure where everyone on the call is from today, but I think that model of care that we've delivered really is applicable to a range of settings. So that's an open offer from us to continue this conversation if that's of interest, if you think that this way of working or model of care might be something that's of interest in your world of work. I think these questions really draw on learning from this work with women and families, but also to go back to Sarah's earlier point around the wealth of policy and practice developments that are happening around maternity. And interest in this area really just keeps growing. So just last week, there were a couple of pieces in the Health Services Journal around the Labour government's new vision for NHS England. That's about shifting the focus from hospitals to community care and increasing reliance on peer support. That piece discussed the BCSE's involvement in maternity and how this can really be strengthened. We also know that Wes Streeting has said recently that maternity safety is at the top of the list of issues that he said keeps him awake at night. We had a little bit of a pre-call today before this session, and we were saying, it's great to have that kind of focus on maternity safety, but from the perspective of this work, what does safety mean to these women? And this is a real opportunity to explore that further. So the questions that we pose here, I think, speak to opportunities that we see for doing exactly this kind of strengthening and really furthering this kind of support for women. And I'm going to hand over to Sandra, who's going to lead us through these questions.
Thank you, Ange. I'm Sandra Guys. I'm the lead for 2 maternity and neonatal voices partnership groups in North Cumbria. I also have a role across the North East and North Cumbria as a service user voice representative. I think what's really important here, and I keep thinking of that activity we did as an icebreaker with that ball of wool, which is a big theme for us, linking us together. And I think my kind of links with different people in this project have started at different stages. And with Happy Mums as a maternity voices partnership group, as we were there, they gave us space to hold meetings. And that was really valuable in creating connections those years ago. But those connections develop over time, and as a lead I was involved with the maternal mental health pilot rollouts, and we did some mapping locally, and Ways to Wellness came into our sort of connectedness, and through that we looked at a project about barriers to access to maternal mental health services, and then this developed further, and we had researchers come and really enrich that conversations in terms of participatory approaches and that collaborative equal partner approach to design. So we have that sense of ownership, but that richness of knowledge and connection and strength of listening to each other, really, which has really provided a very valuable springboard for other projects such as the Mumkind listening project that we did actually quite soon after this actual project. So I've got the last part of this presentation to give, which is really an honour in a way to bring together all those thoughts into this question. And at the bottom of that slide, we've put this illustration, which is about co-production, and how at the start of co-production it has this fuzzy front end, and it sort of, for me, that imagery reflects those networks and those connections, but the thinking, but the importance of what it is in terms of communicating complex things and what the next steps are. So we really need your help in taking this forward. This is the so what. We've listened, we've reached difficult groups in society whose voices need to be amplified, and we want to empower those voices to be active participants. And that's partly that onward journey of using an animation is in the hope and with the support that those people will want to be the voices in that actual animation as well. So the questions are, these women with complex lives and stories, we know they want to be listened to and understood. Why wouldn't you want to be understood? The empowerment of their voices is needed to address inequities. So how do we get closer to a support offer that sees the whole of me, not just in one episode of care, but in that lifelong journey of care as well? The importance of the link worker models being mentioned already by Ange. There's some really good findings coming out of that. But how do we keep that onward signposting, the onward connections to break down isolation for the most disadvantaged, those that have had adverse life experiences, but also everybody who's going through a new experience can be challenged by it? How are we there to make those appropriate connections that meets the needs of that individual? So there's been deep work supporting women and highlighting that they want to be listened to and understood, and they want to have control over their choices. Again, why wouldn't you want to have control over what's happening to you in that bodily autonomy sense, in that mind sense? This work brings sharp focus to the minoritized voices that should be prioritized. So in complex systems, whose role is it to listen to these stories, interpret and shape, and to reduce disempowerment, isolation, and trauma? We return to that diagram at the bottom here of the fuzzy front end of co-production. Is there a fuzzy front end to how systems need to adapt to hear, adapt to really listen, to see the whole of a person, not just in one episode of care or in one work stream of care, but a broader view and interpretation? The Centre for Public Impact published a report that we can share called Learning to Listen Again. It talks about the signals we can listen out for to tell us if we're getting it right in our listening and learning. What signals do you see in your work that you are getting this right or moving towards that direction? So we would like to know your thoughts, and we would like to use this time to capture some thoughts and comments, and this will help us shape our thoughts as we move forward towards developing our animation and thinking around disseminating these messages. So thank you very much.
Thank you. Ash, are we going to go into break? Do we want each room to answer all of the questions? Is that the idea?
Should we let the room just pick one, if that makes sense? Are we happy with that? If they just choose whichever one kind of, resonates with them the most, and then we'll take some comments afterwards. Does that sound like a plan?
Absolutely. Sounds
good
brilliant.
Stuff. Okay, so the rooms are opening now. If we give you guys, shall we just do some quick feedback room by room? Does that sound okay? Yeah, perfect. Okay, so room 1, I had Claire, Kay, Bridie, Jenny, Abby, Lucinda. Who would like to just share a bit of feedback from that room?
Oh, Lucinda, do you want to go through it?
I can. I was typing some notes in the chat.
Oh, well done, perfect.
So I think some of the key themes for us is very much still finding the who could be responsible for that. We haven't found that who yet, but knowing that we need to find the who. and also questions on the how, in that we went through the presentation and this is how we did it, but how could someone in a different department replicate that? What would it cost to replicate that? What systems would they need in place to be able to do that? So we had some discussions around some of the elements that we did in terms of funding, in terms of how much it cost, training people to run peer support and things, in case that is an option to be able to replicate it. Jenny, I think, might be typing her question because we ran out of time to ask it, but I think those were the themes and it was also finding a safe space. So Jenny works, is another part of Maternity Voices, and highlighted that she sometimes just goes to sessions for maybe an hour at a time. So how do you build trust in such a short amount of time if that's all you've got with people? Whereas I suppose the benefit of when we've worked as happy mums, we build that relationship over time, and then we've been able to kind of, I suppose, piggyback on the elements of trust that we have been able to be used for the benefit of this research. And I suppose that was one of the things that I was highlighting to Kay, is that, you know, there's actually one of the members of the group that asked about how do we do this ourselves. I think there's a lot of benefit in finding groups that are doing the thing that you want to be able to do and working with them, as opposed to trying to replicate necessarily. There will probably be a peer support group somewhere. Can they be worked with and linked together a bit like how we've done in this project?
Yeah, brilliant, Lucinda. It's almost that don't reinvent the wheel, isn't it? Sorry, Sarah.
I was just going to say, if there's time for me to make a quick comment on that, because actually a lot of this, we started out with a conversation with NHS colleagues in the perinatal and maternal mental health service. So the initial challenge actually came from them in terms of, we're not reaching women. Can you help us understand why? And they would not have been able to do this because of who they were, because they are professionals, because they've got their lanyards, because they've got their boundaries. They could not do this. So I think there's something to be said for how can we do this? Maybe you don't need to, maybe you need to empower others too. And then, yeah, like that piggybacking thing. Sorry, I should.
Oh, good. Brilliant. Thank you, Sarah. And then should we hear from room 2? So that was Lynette, Vicky, Christine, Rachel, Caro, and Sarah.
I wondered whether, Rachel didn't get a chance to share. So I don't know, Rachel, did you want to say anything before we summarise, or did you want to summarise?
Just probably following. So I'm chair of the Northern Neonatal Network Parent Advisory Group. So I think just that thing, kind of building on one of the points there about avoiding like working in silos, is so important. Like, I'd never heard of this project. Honestly, some of this talk has given me goosebumps. It's amazing. So yeah, I definitely want to like chat to you more about it. But that kind of thing, just like, it's really hard, isn't it, to know where to look. And if you don't know about something, you don't know about it. Obviously, Boost is great for that. But I think, yeah, finding better ways to share stuff, I guess, and just, yeah, linking with people.
Definitely, Rachel. And we're still learning and developing in Boost.
Exactly.
So, we're trying to look at how we can connect people more and run sessions like this. So, yeah, brilliant. Thanks, Rachel.
We also heard from some people who were working in, what was really interesting was where that kind of the choice and that emotional safety met the physical safety. And one of our group was really at that kind of that really tricky edge of that line between, she worked with a consultant midwife, she worked with people who wanted to make choices that were outside the guidelines essentially, but she had that time to work with them. And so but then actually then going back to the clinical safety parameters and how you actually match those up is really challenging.
Definitely, brilliant. And I'm really conscious of time. So room 3, that had Ange, Becky, Kate, Sandra, Georgia and Kathy in it.
Would you like me to share some reflections, group, and if I missed anything, you can jump in. I think the really key word that came through for us was connectivity, and we talked a little bit about how Becky, around the third sector referral coordination in her area, for example, quite often there's a perception around referrals only coming in for over 65s, and she's really interested in how we can use some of this work around listening to make sure actually that we broaden that, and that health and social care pathway can really include parents and partners were part of that picture as well. We weren't just talking about maternal mental health there. I think we left with a question really that Sandra posed that I think is a question we'd like to return to, which is what does seeing the whole of me look like in commissioning? How does this approach fit in commissioning? And I think again that's something that we might take forward from here. How does that life course approach look across a whole commissioning approach? And then just very briefly, we touched a little bit again on some of those connectivity challenges around transport and, you know, thinking a bit differently, thinking about rural mental health. And again, that might be something that might be an opportunity to pick up offline after this session.
Brilliant, really good points. Definitely, Ange. Thank you. Brilliant. I'm conscious we've run over by 2 minutes, and unfortunately people are having to disappear for meetings. So thank you so much, everyone, for attending. As I said at the start, if you think anybody would benefit from rewatching today's session, we have recorded it, so it will be on our YouTube page by the end of the week. Once again, thank you so much to Sarah and the team. Absolutely fantastic and really, you know, really thought-provoking stuff. Definitely. So thank you, everyone, and I hope everybody enjoys the rest of their day. Thank you very much.
Thank you.
Yeah, thank you very much.
Bye.